Overcoming PSSD and PFS. In this video, I'll talk about one really important thing about androgen receptors, and I will talk about polymorphism and silencing of androgen receptors, or insensitivity of androgen receptors. Okay, I will also explain why even taking androgens will not help, or blasting DHT. Okay, and what you can do about it. Okay, so really big thanks to all guys I was able to work with. Okay, so because I have seen many blood tests explaining many things, I have seen Dutch tests and so on. Right now, for example, to check if your androgen receptors are functioning properly, right now I only know how to do with Dutch test. Okay, so but as far as I know, there is also blood test for this one parameter. Okay, so first of all, we are talking about polymorphism and silencing. Okay, difference is that polymorphism is or are changes in CAG repeats. Okay, and polymorphism can be fixed quite easily with, for example, proviron, because there are studies on that proviron is quite effective. Don't overdo. If you need my help, you will find a link in the description. Okay, so proviron is quite effective for this kind of things, but we have also another thing. It is androgen receptor silencing on insensitivity. It means that also if you are using TRT, if you are blasting DHT, nothing will work. Okay, and I will explain why. Okay, and this, first of all, let's talk about how you will determine this kind of androgen receptor dysfunction. Okay, so low free alpha HSD activity may be linked to this androgen receptors dysfunction. Okay, it's not direct marker, but normally it's probably the easiest marker you can do to see if you are if you have androgen receptors dysfunction, okay, or insensitivity. Okay, so another things to distinguish between polymorphism and this insensitivity or silencing is that, for example, you take DHT therapy, and if you are responding well, probably you have just only polymorphism, or you are just improving your 5-alpha reductase enzyme, and this is making things better, or maybe you just needed a higher raise in DHT. Okay, but 3-alpha HSD converts DHT into one metabolite. Okay, and this is 3-alpha androstenediol. Okay, because many guys asking me, okay, so yeah, I did a test, okay, so my testosterone is extremely well. I have one recent client like this. Okay, so testosterone is like 800 something. Okay, so DHT is normal. Okay, so like 80, but is having problem. And recently he did Dutch test, and I took a look at the Dutch test, and what was quite interesting, everything from this was okay, but when I take a look at 3-alpha, 3-beta metabolites, there was an issue. Okay, so first of all, this 3-alpha androstenediol was low, and this is important neurosteroid. Okay, so and if, for example, 3-alpha HSD enzyme is low, 3-alpha diol levels will drop. Okay, so even if your 5-alpha reductase is functioning at some level, or there is like low activity, also problem could be with 3-alpha HSD. Okay, so and this low levels of 3-alpha diol might lead to reduce alpha androgen receptors activation or sensitivity issues. Okay, so right now you can check it via Dutch test. Okay, and finasteride generally inhibits 5-alpha reductase activity. Okay, and this is disrupting also 3-alpha HSD pathway. Okay, some guys have at least the advantage that 5-alpha reductase is not so extremely low. Okay, so they have at least some activity even of 3-alpha HSD. But if you want to check, go check 3-alpha androstenediol levels. Probably your your DHT should be in normal level, but your free alpha androstenediol should be low, and this tells about androgen receptors dysfunction. Okay, so and like I said, free alpha androstenediol is important neurosteroid. Okay, let's talk about possible indicators of androgen receptor silencing via free alpha HSD. Okay, so like I said, free alpha diol G, okay, indicates low free alpha HSD activity. You have then symptoms like low libido, anxiety, depression, and cognitive issues like brain fog. Guys, everyone is talking about allopregnanolone, but free alpha metabolites of DHT are as crucial as allopregnanolone, and that's also way how you can improve anxiety, depression, even anhedonia. Okay, so if you have also pure response to DHT therapy, androgen receptors might not be responding due to low downstream metabolites. Yeah, so like I said, free alpha diol is very good for mood, libido, and anxiety. Increased GABA activity calms the nervous system, okay, lowers anxiety. Neurosteroids effect helps regulate dopamine and serotonin. Low levels are linked to depression, anhedonia, and sexual dysfunction. Okay, so androgen receptors insensitivity and silencing. Okay, so many guys are using things like boldenone or proviron that increase DHT activity. Okay, and they see no results. But the problem is, like I said, with androgen receptors insensitivity, because if there is just polymorphism, okay, or just low DHT 5-alpha reductase, you will feel the benefits. Okay, but if it's not, then it is androgen receptors insensitivity. Okay, there are other ways how to fix it. If you need my help, you will find the link in the description. And why boldenone or for example proviron is not working? Okay, so proviron is a pure DHT derivative. Okay, so very strong androgen receptors agonist. Okay, and cannot convert, or is not converting from testosterone to estrogen. Okay, so boldenone is not a DHT derivates. Okay, it has mild androgenic activity. Okay, so, and has also mild estrogenic effect in guys that have like low estrogen in PFS. It's probably more beneficial than proviron because it can give you at least some estrogen boost. Okay, so proviron, be careful. Even with boldenone, it will decrease SHBG. If you have low SHBG, it will decrease SHBG, and also proviron will lower estrogen. Okay, not to such a big extent as aromatase inhibitors, but will do. Okay, so but the problem is some patients are androgen resistant. Okay, because the androgen receptors are desensitized. Okay, so proviron in that case is useless because it only binds strongly to androgen receptors, but cannot really activate them when they are silenced. Okay, so only activation happen in this polymorphism. Okay, or if your DHT is the main issue, because DHT DHT itself boosts androgen receptors with higher rates. Okay, because testosterone is weak. Androgen receptor supporter DHEA is weak, but if you have a high androgen receptor sensitivity, even low testosterone and low DHEA will activate them. Okay, so that's the problem. Okay, so like I said, both boldenone and proviron will not work if your androgen receptors are desensitized. Okay, so even boldenone from my perspective is a little bit unpredictable with side effects and has long life, like 14 days. Okay, so, and it's suppressive, guys. Okay, so DHT in normal dose is not suppressive. Okay, so but it should not be taken as a monotherapy. Yeah, so testosterone, DHEA, and even boldenone are weaker AR activators than DHT. We already talked about this, okay? So, and if androgen receptors is downregulated or silenced epigenetically, okay, so increased androgens won't necessarily restore function, okay? So if you don't see any outcomes from DHT treatments, okay, then probably you should focus on things like HDAC inhibitors, okay. I work with some clients. Honestly, if we combine DNA methylation, if you address DNA methylation and HDAC inhibitors, they see the changes. Because I have worked with many clients that took, for example, sodium valproate, and things haven't been fixed, okay, with sodium valproate, and it's not the optimal drug, okay, so it can be really hard on the body and so on. So I'm not a big fan of that, okay. So there are also other choices that can work as good, okay. So but it also takes time, okay. So even with sodium valproate it takes few months, okay. But I see quite good result with androgen receptor silencing with addressing DNA methylation, okay. So also why Tribulus may not work, okay. So Tribulus is more likely helpful if you have like 5-alpha reductase activity issues, okay. Tribulus can really support nicely 5-alpha reductase activity. It can also increase noradrenaline, that is important for libido, dopamine, okay. So it stimulates LH, okay. Many guys have low LH, okay. So and if you want to boost androgens, this is a good way. So you stimulate LH, okay. If Tribulus is adaptogen, if everything is okay, it will not do much. Probably what it will do really with good force, it will increase DHEA and will lower prolactin rapidly, okay. So I have really good experience with that. Lowering prolactin is beneficial for both PFS guys and PSSD guys, okay. So like I said, it also upregulates 5-alpha reductase activity, so it definitely should be in a stack, okay. So you just really need to know how to cycle it, okay. So and for example, why DHT creams on penile tissue or applying DHT cream in general will not work, okay. So guys, I was talking about other videos about ratio between testosterone and DHT, okay. You really want to stay in a range like 10:1 to 5:1, okay. So I am a big fan of doing small changes, okay, even with proviron, okay. So I see really difference when clients are taking low dose proviron for a longer time and when they blast proviron. Every time they blast, something bad happened, okay. So but if they use normal dosage of proviron, things are improving, okay. Like I said, if you don't have this androgen receptor insensitivity, if you have just any kind of, if you have low DHT, if your 5-alpha reductase is not functioning as it should be, it can kickstart the process, okay, because there is negative feedback loop or close feedback loop between DHT and 5-alpha reductase, okay. So if you increase DHT, you will increase 5-alpha reductase, okay. But like I said, penile DHT cream, okay. So if you apply huge dosage and if you decrease this ratio between testosterone and DHT, it will lead to this negative feedback, okay. So it's not beneficial at all, okay. So if you want to use, just use small amounts of DHT cream just to make your penile tissue more sensitive, because you have also androgen receptor there, 5-alpha reductase enzyme locally there, okay. So you can use it like that, okay. So because if you blast a lot, you will desensitize the local tissue, okay. So it's not necessary, yeah. So like I said, 10:1 or 5:1 is optimal ratio, okay. But I see guys when they are using higher doses of DHT creams. There is a one X account and they are selling all this kind of shit, okay, and guys, they are using huge dosage of Proviron and DHT cream and high dosage of testosterone. If you blast something, you will downregulate something, okay? So always take the normal dose, okay? So first of all, take a look at your blood test, consult with your doctor, okay? So if you need maybe my help, you will find a link under this description, okay? But don't blast, okay? Just use normal amounts. Even Proviron in low doses is not suppressive, okay? So in higher doses, it can already cause something, okay? So like I said, 10 to 1 is optimal ratio. Okay, that's it. This is how you will determine androgen receptor dysfunction. Okay, this is why Proviron is probably not working. This is why Boldenone is not working. Tribulus, what is going on with Tribulus? Okay, so let me know what you think, guys.